Hi everybody, my name is Mason Everett and I am a second-year veterinary student with the Texas A&M College of Veterinary Medicine and Biomedical Sciences, and today I'm going to be speaking with y'all about heartworms. Here we have pictured some of my babies. We have Remington top left, Dozer top right, Pumpkin bottom right, and Squash bottom left. The reason I have pictured both dogs and cats is because heartworms can actually affect both species. We more so think of it in terms of canine heartworm infection, but there's actually a pretty severe problem with feline heartworm infection as well. So today's video is going to focus on canine heartworm infection, but if y'all enjoyed this video and want to know more about heartworms, I implore y'all to also watch the feline heartworm video that will accompany a PowerPoint presentation as well, as there are some pretty significant species differences in the way cats react to heartworms versus dogs. So without further ado, we're going to talk about canine heartworm infection and canine heartworm disease. Don't get too caught up about differentiating between the two right now. Just understand today the focus is dogs. So what exactly are heartworms and why should we be concerned about them? Heartworms are parasites that can live in the right side of the heart and the pulmonary arteries of both dogs and cats. We're going to talk way more about where the pulmonary arteries are and why they're in the right side of the heart, so don't worry about that right now. Just know that heartworms are parasites and they can infect both dogs and cats. If you look at this picture in the background here, we have a cut section of a heart, and all those like spaghetti-like structures that are coming out of the heart are actually adult heartworms, and they can get pretty big. The males can be anywhere from 4 to 6 inches long, and the females can be about twice that size. So if you can imagine a bunch of worms of that length, pretty much the size of spaghetti, getting clogged up in the heart, how they could eventually cause issues, you know, you can start to think that heartworms are pretty bad and something we would want to prevent. And another thing I want y'all to really think about when you think of heartworms is to think heart. They want to live in the circulatory system or the cardiovascular system. They want to be in the blood and they want to be in the structures associated with blood. So this is very different compared to the general parasites we think of in our small animal patients, as in dogs and cats. Usually when we think about different parasites, the majority of them that we're concerned with are in the GI tract, the gastrointestinal tract. That means somewhere along the stomach, small intestine, large intestine. Those are the areas that the normal, let's say normal parasites like to hang out. The heartworms are not in the GI tract at all. This is important because this means that we're never going to see heartworms coming out of our patients. They will remain within the blood, within the heart, and it's going to have pretty severe ramifications about how we try to prevent heartworms and also how we need to treat them. And also the damage that they can cause to the patient is going to be a lot different than the normal GI parasites that we think of. So heartworms are heart. Understanding heartworms really involves understanding the life cycle of the heartworm. That's going to tell us a lot about how they're transmitted and again, what kind of damage they can cause. So we're going to start with the adult heartworm living in the heart. So that's going to be a dog that has been infected for a while with heartworms. They're heartworm positive. They have adult heartworms that are living in the heart, the right side of the heart and the pulmonary arteries. Again, we'll talk about what those are in a little bit. Those adult heartworms are reproducing and they're creating something called microfilaria. The simplest way to think of microfilaria are as baby heartworms. They're the most immature form of the heartworm. And when those adult heartworms create microfilaria, the microfilaria are released into circulation. And once they're out in circulation, they're moving through the bloodstream of the entire dog. They're everywhere. And they're very, very tiny, if you can imagine, because they have to be able to move through all of the blood vessels. This is important because when a mosquito bites a dog that is infected with heartworms, so we have a heartworm positive dog that gets bitten by a mosquito, that mosquito will suck the blood of that dog and pick up those microfilaria. So that mosquito is now flying along unaffected by these microfilaria within it, and that mosquito becomes pivotal to the heartworm life cycle for 2 reasons. Number one, the mosquito is how heartworms are going to be transmitted. So when that mosquito goes on and bites a new dog that was previously uninfected with heartworms, that's the way that these heartworms are moving from patient to patient. And then number 2, the mosquito is going to be very important for the ability of those heartworms to mature. So when the mosquito picks up the heartworm, it is in its most immature form. It'll be in that microfilaria form. And if y'all can try to remember that term microfilaria, remember that just means basically baby heartworm. It's going to be talked about a few times throughout this presentation, so it's best if you can keep that one word. I won't ask you to remember any other big words, but that one if you can hold on to, I really appreciate. That mosquito will pick up those microfilaria and they will begin to mature or grow into a larval stage. I don't care if you remember that it's a larval stage, I just wanted to be complete with y'all today, but you need to understand that the mosquito is required for these heartworms to begin to mature. At this point, we're just going to refer to them as immature heartworms. It doesn't matter particularly what stage they're in for us right now. They're immature for the time being. So if you see larval, think immature heartworm. So once that heartworm has reached that immature stage or that larval stage, it can be transmitted to our new patient. So essentially what's happened so far is we had an infected dog, a heartworm positive dog that got bit by a mosquito, and that mosquito carried those heartworms to a new dog and bit that dog. And assuming that dog is not on heartworm preventative, when it is exposed to heartworms, there's a very, very high likelihood that it will become heartworm infected as well. So once within the new patient, those heartworms will spend approximately 5 months, the immature heartworms, moving throughout the body of the dog, and eventually they want to settle in those pulmonary arteries and in the right side of the heart. Once they're there, they can mature into the adult stage. And once in the adult stage, those heartworms can begin to reproduce again, producing more baby heartworms or microfilaria that will be released into circulation, and this whole cycle starts over again. Now another mosquito can come along, bite this newly infected dog, carry them to another dog, and now we have the spread of this infection. But the biggest thing I want y'all to take away from this slide is that mosquitoes are required for the life cycle of the heartworm, for the maturation or the ability to mature, and then also for transmission. When you think heartworms, there has to be a pretty close association in your mind with the mosquito, so keep that in mind. So I've been talking a lot about the pulmonary arteries and the right side of the heart, and I really want y'all to be able to understand just exactly where that is. So the right side of the heart is going to essentially encompass the right atrium and the right ventricle. Don't worry about remembering the names of those structures. That's just their particular names. However, they make up the right side of the heart, and that's what we'll talk about it in terms of. But I just want y'all to be aware, I know you're looking at this picture and it looks like the right atrium and right ventricle or the right side of the heart is on the left side, which makes absolutely no sense. It actually makes good sense, I promise. So if you think about if your own heart is in your chest, right? Your right side will have the right side of the heart on it. So the normal orientation within an animal or within yourself, the right side of the heart is on the right side. But as a doctor, so let's say I am the doctor and I'm looking at my patient's chest, my left side will be their right side. So the orientation is flipped. So when we look at these pictures, we're looking as if we are the doctor looking at the chest of our animal. So if that's a little confusing, feel free to take a second, pause, and think about it. But the right side of the heart in the patient is on the right side. It's just we look at this as if we are the doctor. So it appears on our left field of view. And then the pulmonary arteries, when you think pulmonary, you just have to associate that term with the lungs. Pulmonary arteries are bringing blood to the lungs. And I have a little circle to show y'all just exactly where they are, and then a little arrow pointing to the lungs. But you just have to associate that. Now, if you could imagine these worms, they like to be in the right side of the heart, but mainly they want to be in those pulmonary arteries. And because of this, like I said, the blood is being pushed to the lungs from there. All the blood in the body is going to come into the right side of the heart, go through that pulmonary artery to the lungs. And there, blood, the whole job of blood is to take oxygen, and then it'll go into the left side of the heart and then out to the whole body. And it supplies oxygen to all of the organs, all of the tissues, all the structures in your body go through this one simple system. And the pulmonary artery is the means by which blood gets to the lungs to get its oxygen. And those worms really like to live in those pulmonary arteries. So if you can imagine us clogging the only tube that is transporting blood to the lungs to supply the rest of the body, how that could have some pretty serious ramifications on our patients and cause them some pretty severe health issues when the infection gets really, really big, multiple worms and stuff like that. you can start to think about how heartworms could be a serious, serious problem. So heartworm infection versus disease. Heartworm infection is going to be when we have a patient that comes in and we heartworm test them, and we're going to talk about testing, but we heartworm test them and they come back positive, but otherwise, outwardly looking at this patient, you wouldn't be able to tell that they were sick, essentially. They're going to be happy, they're going to be healthy, they're not going to have any symptoms associated with heartworm disease. Heartworm disease is going to encompass when the worm burden or the number of worms, of heartworms, adult worms living in those pulmonary arteries and even the right side of the heart becomes so big that it begins to damage the heart and the lungs. And at this point, we're going to see symptoms outwardly of these patients that show us that they're sick and that they have a form of heartworm disease. And so we have a couple symptoms listed here. There are certainly more, but these are some of the most commonly seen clinical, I would say. So the first one you might see is a cough, and it could be called a non-productive cough. That means they're coming in and they're coughing a lot, it seems like, but they're not coughing anything up. There's no mucus, there's no nothing. So we call it non-productive because it's not producing anything. And the next symptom that generally follows is going to be exercise intolerance. And if you think about it, exercise intolerance actually makes a lot of sense because remember we said that the pulmonary artery is allowing all of the blood in the body to make it to the lungs. And if that process is impeded, the blood is not going to be as well oxygenated. It's not going to be able to transport as much oxygen to the organs, to the tissues, as it normally would be able to. So when these animals exercise and their muscle is demanding more oxygen because it's trying to work harder and it can't get that oxygen, they're going to be tired more quickly. So that's what exercise intolerance is they're not going to be able to tolerate exercise as well as they normally would have been able to. And another phenomenon that follows heartworm disease is going to be heart enlargement. And this makes a lot of sense if you think of the heart as one giant like water hose. Normally, blood is flowing in just as fast as it's flowing out. But when you take that water hose and you kink one side of it, let's say these are at the pulmonary arteries where those worms are blocking the blood flow, now the pressure within that water hose is going to increase because that blood, that water, it doesn't have anywhere to go. And so the heart essentially turns into a balloon. At this point, it just starts to fill up because more blood's coming in, but no blood is going out, or very little blood is going out. And so it expands. And a growing heart in general, an enlarged heart is not really a good thing. It's not something we want to see. And it kind of makes sense if you think about the contractility of the heart is right here. It's just pumping blood all the time. As it gets bigger, it loses that ability to contract down. And when that happens, it's not pumping very efficiently. And when it stops pumping efficiently, now we have led to heart failure. So again, heart enlargement, not a good thing, and it's caused by those worms, again, clogging up those pulmonary arteries. So if you look down at the bottom of this picture, we have some radiographs, is the technical term, but we'll call them x-rays. And I don't expect anyone to feel like they can read x-rays after watching this video, but I think y'all should be able to notice some pretty key differences between the normal x-ray on the left and the heartworm disease or abnormal x-ray on the right. The kind of circular structure, we'll start with the picture on the left, the circular structure in the middle of that chest cavity that you're seeing, kind of at the bottom, that's the heart, and that's a normal size heart. That's what we want to see. And if you look at everything that's kind of black, that's above and to the right of it, that's our lung field. And if you think about it, it makes sense why it's kind of see-through. You can kind of see to the other side of the animal because the lungs are normally filled with oxygen. That's what we want. We want the lungs to be filled with air. That's a great thing. But if you look at the picture on the right, number one, you can tell that heart is way bigger, 2 to 3 times bigger than it is in the normal chest cavity. And then that lung field went from being almost see-through to being really, really murky. And we're going to talk in a minute about the damage that can be done to the lungs. But if we saw an x-ray like this, we would really be starting to think, okay, this patient has heartworm disease. The heart's enlarged, that's problematic, and now it's affecting the lungs. So not only can heartworms damage the heart, they can also affect the lungs. And we're going to talk about that right now. So a really important condition that can occur with heartworm disease, and particularly when we start talking about heartworm treatment. We're going to be talking about treatment in just a moment. That's when we're actually actively trying to kill the adult worms that are living within the heart. But when we go to kill those worms, there's a condition that is called pulmonary thromboembolism. And this involves, don't worry about that name, it's just a big fancy term, but I'm going to explain what it is. When these worms die in the heart, they can't go anywhere. Like I said, you'll never see them leave a patient because they're in circulation. So what has to happen, especially when we kill them in heartworm treatment, is these worms have to disintegrate over time. But what can happen when they die, pieces of them or whole worms can begin to move deeper within those pulmonary arteries into the smaller vessels of the lungs. And what happens is they get stuck and they either block blood flow or greatly impede blood flow. And this can cause some serious damage to the lungs because now you're not having blood flowing to the lungs. And when this occurs, it is considered a medical emergency. If you look in this picture right here where the arrow is pointing, that's a blood clot. And like I said, if these worms get down into these smaller vessels of the lungs, they can either block blood flow or greatly impede it. And so when blood flow is slowed down, it increases the risks of clots forming. And when these clots are thrown, again, like I said, it becomes a medical emergency for these patients. And so we'll talk a little bit about why that's really important when we start treating these animals for heartworms. But now that we've talked about the damage heartworms can do and how they come about and whatnot, we need to talk about where they are. So if you look at this picture, this is an incidence map from 2019. The heartworms cases are mostly seen in our coastal regions. And that makes a lot of sense when you think about the life cycle of the heartworm, how we said the mosquito is imperative to the life cycle of the heartworm. Heartworms are going to thrive where mosquitoes thrive. So if you think mosquitoes like hot, humid, stagnant water, stuff like that, you're going to see a lot of that in our coastal regions. And so you'll have a higher incidence of heartworms. But if you look at this map as a whole, you can see that heartworms are essentially everywhere. They've been diagnosed in every state except for Alaska, but their incidence is spreading more so right now for a couple of reasons. One being an increase in pet travel. You know, if I have a dog that's heartworm positive, and I decide to move to Nevada where they may not have a lot of cases, but my dog gets out there and gets bit by a mosquito, and that mosquito picks up those microfilaria or baby heartworms and then goes and bites another dog that's not on preventative. Now we've started the spread of heartworms. So increased pet travel has contributed to the spread of heartworms as a whole. Also, just general climate warming has increased the habitat of the mosquito and thereby increased the ability of heartworms to spread throughout the dogs and the cat populations as well. And then an interesting one, this one is called microclimates created by cities. Essentially, they're heat pockets. And these heat pockets are associated with increased industrialization, more cars, more people. A city just has more heat around it. If you've ever been in the car and you've watched the thermometer tick up just a little bit as you pull into a major city, this actually creates a favorable environment for these mosquitoes to survive in regions where they might not have been able to before. So that has contributed to the spread of heartworms as well. So when we talk about detecting heartworm infection, the majority of clinics have a go-to of the IDEXX SNAP test. What this is testing for is a protein or an antigen associated with adult female heartworms that are reproductively active. I want y'all to mostly just think of adult female heartworms, because that's going to have a pretty big role in when we begin testing our animals, is this test is capable of detecting adult female heartworms. So when we start talking about testing, I just want y'all to remember that we can't test until we have adult female heartworms present. But we're able to run this test by taking a couple drops of blood, and it associates that with an antigen that these female adult heartworms are producing, and we can see if an animal's heartworm positive. And these tests are run in clinic annually. That means we do it every year, regardless of the circumstances of the patient. It needs to be done every year, even if they're on preventative, because we want to make sure that we don't allow them to get to that point of heartworm infection and then heartworm disease, where it can cause some pretty serious damage. And if we decide that we have a patient that's heartworm positive, we want to make sure that we confirm that diagnosis. In any clinical setting, if you have some sort of test or some sort of diagnostic and you're confirming a diagnosis, you want to try to confirm that in multiple ways, because it's just good science in general, but also it may have really big ramifications on the patient. And in the case of heartworms, if we say that an animal is heartworm positive, they're going to have to go through treatment, and the treatment can be really hard on our patient and also become really, really expensive. So if we can diagnose multiple ways, we want to. And how we do that is by observing microfilaria on a blood smear. So those baby heartworms, remember we said, are moving through circulation. They're moving throughout the bloodstream of our patients. And if we take a drop of blood from them and put it on a slide, we can observe those microfilaria. And so I actually have a video for y'all to watch. And now sometimes through these recordings, the video can be skewed a little bit. So I've attached the link at the bottom. If you can't see it very well, I implore y'all to look it up. Even if you look at microfilaria on YouTube, it should pop up and you can see. What we have here, I'm just going to explain before I start it, is a sample, a blood sample, and all those little red dots are red blood cells. So we're down to a cellular level. These guys are really tiny. And in the middle of the screen, kind of by that arrow, you're going to see something kind of just moving in the blood. And that's our microfilaria. And so it can be a little bit hard to see, like I said in this video. There are ways to get the red blood cells out of the blood smear, but just the simplest way in clinic with a trained eye, you can see these guys pretty readily. So I'll go ahead and start the video. Okay, so if you look right here, and he's going to move it a little bit right there, that just moving kind of wormy little part of the red blood cells. You can just tell something's different because everything else is still over here. That's our microfilaria. And that, along with a positive IDEX SNAP test for that antigen or protein created by adult female heartworms, is going to tell us this patient has heartworms and we need to do something about it. Let's see if we can move on. There we go. So when do we want to start testing? I kind of already put out the information that y'all would need to know about this, but I want to reiterate it. It takes approximately 6 months for an immature heartworm to mature into an adult. Like we said, the antigen or the IDEX SNAP test is testing for an antigen associated with adult female heartworms. If it takes 6 months for an immature heartworm to mature into adult, we cannot start testing that dog till at least 6 months of age. So I'm talking about puppies. We can't start testing puppies until they're at least 6 months old, because that is the earliest we're going to be able to detect a heartworm infection. And when we do that on their 6-month birthday, that's under the assumption that they were infected with heartworms within the first couple days of their life. So it's much more common to start testing around 7 months of age. And then we want to do that every year thereafter. Like I said, regardless of whether or not they're on preventative, we want to make sure that we are heartworm testing them to keep them from getting heartworms. And in the event that they do come back positive, we've confirmed it hopefully with a microfilaria blood smear, we've decided this patient is heartworm positive, we're going to have to proceed with treatment. It's the only way that we can ensure that this patient is going to hopefully live longer and have less damage to their heart and lungs. So I don't want y'all to get confused with heartworm treatment versus heartworm preventative. Preventative is what we do to prevent infection. That's not what we're talking about right now. We're talking about this dog is heartworm positive and we need to fix that. It's heartworm treatment. So treatment, the sooner it can be done is going to be the better for that patient. They're going to have a better outcome. Like I said, we're going to minimize the damage to the heart and the lungs and hopefully prolong the life of that animal as much as we possibly can. Treatment is going to include a 1-month course of antibiotics that actually targets a bacteria that live within heartworms. Don't worry about it. They're called Wolbachia. I'm hoping to make another video specifically about Wolbachia because they're actually quite important to the heartworm life cycle and also to the damage done to the heart and lungs. But for now, just know that treatment doesn't start immediately. We have to first take care of those bacteria and then we treat the animal. And the treatment protocol, once we've done our antibiotics, involves 2 to 3 injections given over the course of weeks. And we give them in the muscle and it's kind of by the spine. So it's not very comfortable for our patients, not a very enjoyable experience. But the most important thing that I want y'all to remember about heartworm treatment is once we treat this animal or once we start the treatment process, we have to keep this patient as calm as possible. Remember when we talked about that crazy big word, pulmonary thromboembolism, that involved pieces of heartworms, of dying heartworms breaking off and moving in those smaller vessels and causing blood clots? That can occur with heartworm treatment. And the way we try to prevent that as best as possible is to keep that patient as calm as possible. Because if they get really excited, they get their heart rate up it can facilitate those worms breaking off and causing those blood clots that can put them in an emergency situation. So we try to keep them from running, from jumping, from getting overly excited when people come home, crate resting, stuff like that. So if you can imagine for weeks that this is really not enjoyable for our canine patients. And therefore, the best way to help our canine patients is to prevent them from getting heartworm infection in the first place. We don't want to get to the point where we have to do heartworm treatment because it's not fun for anyone. And like I said, it can get really expensive really quickly. There are a ton of different heartworm preventative options out there. The majority, I would say, are given monthly. There are some now you can do twice a year, and there's some you can even do once a year now. So you don't even have to worry about giving it on time, anything like that. You just have to get a shot and you're done. Whatever treatment or whatever, preventative option you decide to proceed with, the best thing you can do is make sure you follow the rules of that preventative. That means giving the proper dosage and the proper interval. Proper dosage means the proper amount. So if I have a 50-pound dog, but I'm only giving him preventative that's for 40 pounds and less, I'm giving a window of opportunity for those heartworms to work in and potentially cause an infection because I'm not making sure my pet is fully covered for his weight. And then proper interval means that I'm giving it as much as that prescription is prescribed for. So I'm making sure if it's a monthly preventative that I'm giving it every month. I'm not missing a couple months and maybe coming back, 4 months later, and I can't remember when the last time I gave it. Again, that gives a window for those heartworms to cause an infection and potentially hurt our animals. And then again, regardless of what preventative we decide to work with, we still need to be getting that dog heartworm tested every year. There are ways that heartworms can work their way in. We think we're giving preventative well. It turns out that our dog actually spits the preventative out behind the couch when we're not looking, and there's a pile of 10 months worth of heartworm pills back there because he doesn't like the taste of it. Stuff like that happens, it's a part of life. So the best thing we can do is to keep testing our animals and make sure that they're staying safe, and our dogs. And so that pretty much wraps up what I wanted to talk with y'all about today about canine heartworm infection and heartworm disease. If y'all liked today's presentation, I implore you to also watch the feline heartworm infection and heartworm disease video. There are some species similarities between dogs and cats, so you'll find a little bit of review on there, but there are some major ways in which cats react differently to heartworms that really changes the way we have to detect those heartworms and then what our treatment options are after that. So I appreciate y'all sticking with me today. Thank you so much. I hope you enjoyed the video.